Saudi Arabia recently announced launching a fund for AI. They launched a 40 billion USD for AI. This is more than the entire budget of Nigeria. Over 40 billion USD in AI. Our budget of 2024 was not up to that. Use the opportunity also to remind our states and the federal government that investment in AI for medical practitioners is inevitable. It's mandatory if we want to support the system in saving lives and also in early disease detection, among many others. This one is inevitable. Saudi Arabia recently announced launching a fund for AI. They launched a 40 billion USD for AI. This is more than the entire budget of Nigeria. Over 40 billion USD in AI. Our budget of 2024 was not up to that. This is only in AI, not in technology, only in artificial intelligence. 40 billion USD. One of our major challenges today is lack of investment in technology that are critical. When you visit our hospitals here in Nigeria and you visit other African countries like Egypt, Morocco, Tunisia, you will just be surprised. Are we in the same African continent? Because they are far ahead of us. Today you can discover a federal teaching hospital, federal medical center without a functional MRI machine. It's worrisome. It's worrisome. Because this is part of what we call a medical security. The way we agree that physical security is important is the same with our medical security. Number two, I will recommend also training and retraining of medical practitioners in AI. This is also very important. We need to partake in training on how to deploy AI to successfully conduct either our research or our investigation or any other function in the hospital or in our universities. This is very important, training and retraining. The evolution of AI we are witnessing today, if you remain static and dormant for only 1 year, you will discover that you are no more relevant. And without training and retraining, your job security is going to be challenged. Except if you are going to rural areas in our local government where they are far from technology. But as long as you want to compete with other African countries, you will discover that technology is inevitable in your work as a medical practitioner or as a medical doctor. Even though I always argue that AI doesn't take your job, but people who master AI, your colleagues who become experts in AI are the ones that will take away your job from you. So AI in itself is not threatening your job in any way, but your colleagues who master AI, who master the application of AI are the ones that are challenging you and also trying to take away your job from you. So training and retraining are essential. Number three, developing startups in AI for medical health care. It is important that we prioritize our local solutions.